Well, healthcare facilities in the Nelson Mandela Bay region, this is in the Eastern Cape now, face many challenges, including crumbling infrastructure, resource shortages, and inadequate support for staff and patients. And one such facility is the José Pearson TB Hospital, where we're told there is no running water. Patients and the staff there are often forced to collect water with buckets just to meet their basic needs. And this raises serious concerns for a hospital that is treating a highly contagious disease. Newzroom Afrika's Sipha Kema is outside the hospital there and will share with us a little more insight. Sipha, good morning. I think we've laid it out quite well, the condition and the risks, and as always, we're worried about patient well-being.
Yeah, that is true, Iman. I mean, when we're talking about the José Pearson TB Hospital, we're not talking about just an ordinary clinic or small hospital. This is a specialized hospital that mostly deals with TB that is resistant to drugs, and not just only the hospital, but also a research unit is also based here. Now, when such a hospital that specifically caters to drug-resistant TB has issues of water supply. So, as you mentioned, that the patients, as well as we were informed actually by the unions, and they were telling us that the patients at this hospital, as well as the healthcare workers, are also expected to collect water using buckets. Now, this puts in question, as you mentioned, the issue of hygiene. But that not only does it do that, but it puts pressure on the healthcare workers as well as the patients, ailing patients, might I add, on everything else. But when we spoke to Denosa, talking about some of the issues such as being understaffed and the issues of resources, and also how that then translates to how patients are then served by healthcare workers, because we have heard several stories coming out on social media regarding some of these healthcare facilities and allegations of abuse. Now, we asked Denosa about that, and they were saying that it is simply not the union's fault and that the blame should be on the provincial government, because some of these healthcare workers they react this way because of the working conditions that they face. And this is what they had to say to us.
All right, Sipha, we don't have that bite, so I'm just going to ask you to recall what was said and then just talk to us about the plans around managing this in the aftermath of what you've just shared with us now, the crumbling infrastructure and the real impact on quality service delivery.
Yeah. Now, at this particular hospital, the issue here is not having access to running water, having to fetch water with buckets, which of course compromises the patients, but also the healthcare workers themselves, putting in extra pressure on their shoulders, as we had already spoken about the issue of staff shortages at these healthcare facilities. Now, Denosa says that the reason for these shortages was because the provincial government, Department of Health, has not implemented the employment strategy plan for several years now. They told us that a number of the executives, from the executives right to the clerks, are just acting. There are no permanent positions or employment. And they say that now this is a problem and a crisis, because having staff shortages means pressure on the healthcare facilities as well as the healthcare workers themselves. Also, the issue that we saw last week, where they took to the streets, healthcare workers at Doranginza took to the streets because of unpaid overtime, has put also pressure on the healthcare facility and how they treat patients and how they service patients. Because during that time last week, for a few days, patients were complaining that they were not being serviced, that they were being turned back. And, Iman, these are not the only facilities. Now, from here, Iman, we're going to move to Colchester Clinic. Now, when we talk about dilapidated structure, we're talking about a clinic that should be closed down. No running water, no electricity, dilapidated infrastructure. The roofs are caving in, but it is operational. Now, you could just imagine what that is for the healthcare workers, but also for the patients. So we're going to be talking to the healthcare workers themselves. So we also hear straight from the horse's mouth the kind of conditions they're working under. And of course, we're going to later speak to those that bear the brunt of a collapsing system.
Sipha, Kema, and of course, accountability must be sought from the local health authority. Sipha, Kema there on the move, documenting collapsing and dilapidated infrastructure in the Nelson Mandela Bay municipality.